Good day to everyone. I'm Engineer Trinidad Rivera from the Philippines. First and foremost is I would like to thank the organizing committee for this conference for inviting me to do this presentation for you today. I will now share my slides with the audience. The topic that was given to me was enhancing policy outcomes of citizen science. The topics to be discussed includes the definition of citizen science, practical applications and engagement with citizen science groups, such as the ALU-TUCP, Healthcare Without Harm, Ban Toxics, Eco Waste, MAAS, IPEN, TUCP, and the way forward. Let us first define what citizen science is. Citizen science is the practice of public participation and collaboration in scientific research. For this conference, I think you have discussed this definition thoroughly. So, through citizen science, people share and contribute to data monitoring and collection programs. Citizen science have been established in mostly first world countries, but it's now gaining ground in low-middle income countries in Asia, such as the Philippines. The typical process of conducting research studies are often tedious and needs a lot of resources, including manpower, time, and budget. And for studies that would need human biomonitoring, we would have to deal with a lot of ethical issues, especially if you would like to see different population groups, like children and pregnant women. At times, selection of the population for the study is also a constraint, as interaction between the researcher and the population have not been fully established. This is one of the areas where citizen science can make these research studies work. The very first collaboration that we have established when I was at the DOH or the Department of Health before was with the ELAC or the Environmental Legal Assistance Center, which raised concern on the health of former miners in a Mercury mine in Palawan in the 1990s. The DOH, together with the UP National Poison Management and Control Center, collaborated with the community, local government units, and ELAC to conduct a health assessment of former Mercury miners. The government provided the necessary health management and expanded the assessment to the environment, to which the local government unit provided long-term solutions in terms of the water supply and the health monitoring of the residents in the area. Whenever we would need to conduct health and environmental monitoring, including collection of samples, for instance, fish samples for mercury testing, residents and local officials would easily provide assistance to the team. These efforts were documented and scientific papers were published accordingly. Mercury as a chemical of concern in the country, if I remember correctly, in 2006, we have had 3 mercury incidents necessitating government action regarding this chemical. First was the issue of mercury contamination in fish attributed to a large-scale mining in Bicol. The DOH, together with the UP National Poisons Management and Control Center, deployed a team to look into this matter. Second, while we were doing the health and environmental assessment in Bicol, a second incident of a mercury spill in a school in Manila was brought to the attention of the DOH and necessitated the convening of the Interagency Committee on Environmental Health. Third was the issue of a mercury poisoning in a high school student that have a very poor prognosis and would have resulted in kidney failure if not for the timely referral and intervention of a medical toxicologist. This brought to light a question from the then Secretary of Health, and which I quote, "What about our health workers in our healthcare facilities? How are they doing in terms of mercury exposure, since we are using mercury-containing thermometers and sphygmomanometers?" The DOH made its own rapid risk assessment, which showed the risk of health workers and patients to mercury. Thus, with continuing awareness raising from these 3 groups, Healthcare Without Harm, Eco Waste, Ban Toxics, we are proud to say that we were the first to implement the phase out of mercury in healthcare facilities. The Philippines has also ratified the Minamata Convention. The Philippine Department of Health issued Administrative Order 2008 calling for the phase-out of mercury in medical devices across the country by 2010. The PhilHealth revised its accreditation policy and ordered the non-accreditation of non-mercury-free hospitals. The Philippines Department of Interior and Local Government issued Memorandum Circular 2010-140 enjoining all provincial governors, city mayors, municipal mayors, DILG regional directors, and others concerned to ensure compliance to the Department of Health's Administrative Order 21, mandating gradual phase-out of mercury-containing devices in all Philippine healthcare facilities and institutions. Mercury in healthcare facilities in the Philippines has had a growing number of hospitals that are moving towards mercury-free healthcare. So in the Philippines, more than 600 hospitals are moving towards this mercury-free healthcare. And a support statement also requested the Department of Environment and Natural Resources to provide storage for the mercury-containing devices that will be taken out of the hospitals. Because of the mercury spill incident in the school in 2006, continuing collaboration with the Department of Education and ban toxics was done in schools. Likewise, activities towards generating the necessary data on mercury in the ambient and working environment in artisanal small-scale gold mining have provided the local government duties the impetus towards enacting relevant local ordinances, legislations to protect their constituents. On another issue, the National Poison Management and Control Center of the Philippine General Hospital and the East Avenue Medical Center provided a summary report on silver jewelry cleaning poisoning, both cyanide and non-cyanide containing, which consists of around 147 cases and 4 mortalities from non-accidental or deliberate use and accidental misuse of silver jewelry cleaners, among others. The EcoWaste Coalition persistently and consistently raised the issue in its tri-media campaigns and platforms and provided information to the regulators as to the entities selling these products, which would provide the basis for regulatory action. In a joint advisory, the Health Secretary then, Enrique Ona, and Environment Secretary Ramon Paje, said that there has been an increasing public health concern over cases of poisoning attributed to such solutions as documented by the UP National Poisons Management and Control Center, which led to the joint advisory on the ban on the silver jewelry cleaning agents by the DOH and the Department of Environment and Natural Resources. Another area of concern for the EcoWaste Coalition is on toys and childcare articles, where they have been monitoring harmful chemicals and reporting the results to the regulatory agencies such as the FDA and the DTI, and this resulted in the issuance of the FDA Circular Number 2019-004 on the ban on bisphenol A from infant feeding bottles and sippy cups as child care article products. The Philippines is primarily a Catholic nation. Hence, the Catholic Church has been actively supporting the initiatives on issues that affect the community. One such church-based organization is the Marinduque Council for Environmental Concerns, or MAAS. It is a church-based non-government organization based in Marinduque Island, Philippines, working on environmental justice, disaster risk reduction, climate change adaptation, among others. It was founded in July of 1996 to confront the issues on mining and disasters in Marinduque and the Philippines. We have also had the opportunity to work with the Diocese of Kidapawan on the issue of arsenic in geothermal areas. Since the central office of the Department of Health cannot be present in all of these activities, the DOH, together with the UP National Poisons Management and Control Center, have empowered the residents in the area in terms of the science. Thus, these church groups are now involved in multi-partite monitoring groups and have been vigilant in their work. Next is the issue on aerial spraying. This issue was raised by the affected communities in these agricultural plantations, and the recommendations of the studies that were undertaken and the assessment supports the surveillance, environmental monitoring, and further epidemiological study on the health effects of pesticide usage. Further recommendation includes the implementation of good public health practice to protect populations from unnecessary exposure to harmful chemicals through appropriate risk reduction measures. And through this issue, it highlighted the precautionary principle espoused by the Rio Declaration, of which the Philippines is a signatory. We have also had alliances with labor groups on the issue of asbestos. We provided inputs in collaboration with the labor groups, we provided inputs to the national programs for the elimination of asbestos-related diseases. The campaign vigilance prodded government action to attend to an improper removal of asbestos and asbestos-containing materials from the defunct Manila Thermal Power Plant and the Central Bank building. It also discovered that the wire gauze used in primary, secondary, and tertiary schools and professional laboratories used in many decades contained the deadly chrysotile asbestos, prompting officials to issue a memorandum phasing out and banning its use in several schools and campuses. With this in mind, how does citizen science help policy development and regulation? It increases public participation in scientific research and will ideally cultivate a citizenship that is knowledgeable about the scientific enterprise. It will encourage people to take a stake in the world around them. It is hoped that this informed public will play an invaluable role in influencing larger decisions about science policy. It also helps in filling up of the gaps by gathering crowdsourced data that would be hard to obtain due to time, geographic, or resource constraint. Especially in this time of pandemic and with the advent of technology for our smartphones, this would be an important aspect in providing information to policymakers. Leverages resources by using the efforts of a large group of people to research environmental problems that government may not have the resources to pursue. It builds meaningful relationships with communities to increase engagement and problem solving with local units to promote open government. Citizen science informs research and policy in terms of enabling researchers to view and utilize data from myriad subjects and locations across the globe all at once. The results of research gained through citizen science projects can be used to inform local policies, as what I have presented, enhance formal and informal education initiatives, conserve natural resources, and support environmental sustainability. Data suggests that participation in citizen science helps improve literacy and understanding among members of the public. However, this is not without challenges. Citizen science faces a number of challenges, including data quality and recruitment, in terms of both persuading more scientists to work on such projects and enlisting enough citizens to participate in them. Papers published in the past few years have identified flaws in citizen-sourced data, including deviations from standard protocols and biases in recording or in the choice of sampling sites. This also holds true for formal research studies. Researchers and participants are also encountering challenges with ethics, data use, and privacy. Our way forward, citizen science has amazing potential, as I have shown in the previous discussion, as an innovative approach to data gathering and experimental design, as well as an educational and outreach tool. It can really provide the policy direction for the government and other stakeholders. Let's make sure that future citizen science projects have sufficient rigor to earn the respect of participants, scientists, and policymakers. This ends my presentation, so thank you very much.